Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Gavin Courtney.
And thank you for joining us this morning.
It's a pretty breezy morning up here in Belize City. And we are bracing. There was a bit of showers last night, actually.
Yeah. We should be feeling the effects of a tropical wave. It doesn't seem like it's going to be consistent rain, but we're going to find out what our forecasters say about that. As I know people had been expecting rain since Wednesday, yesterday.
I know, and there were a bit of showers, but I was expecting a little bit more. But it's
I'm
good.
fine with what we have.
I know, that's what I was about to say. Yeah, everything, plants got a bit watered, and that was nice.
Yeah, of course.
But of course, a lot is going on. Shortly before we started, Marlene and I were talking a bit about the Olympics. Of course, that has all the buzz internationally. And if you guys have been watching the Olympics, I'm sure you'll notice some of the events and the medal race that's going on so far. Yeah. And of course, we have our own athletes and our delegation that is in the Tokyo Olympics. And those events, the various events, I should say, are going to be starting up this weekend.
Yeah, that's right. We have the first two heats for the track on Saturday and Monday, and then our first canoe Olympian should be in his heat on Sunday. So it's a big weekend ahead for the Belizean Olympians. And, I can only imagine the anxiety they're having right now.
Absolutely. And to compete on such an international stage, even though there's no spectators there, it's still huge. I mean, it's probably the biggest international sports event in the world. And it happens, of course, once in every 4 years. And, of course, it was delayed from last year.
Yeah.
And but, of course, speaking of anxiety and pressure, of course, another Olympian who has links to Belize, who, of course, has been performing so far, is Simone Biles.
Yeah, big story.
Exactly. She's been making a lot of international headlines recently for her withdrawal from, I believe it's 2 events now, for the reasons that she's protecting her mental health.
Yeah.
That there doesn't seem to be anything wrong with her physically, but her mental health is preventing her from competing, and it's making a lot of international headlines because, of course, this is sort of something that we've not seen athletes openly admit as much as recently.
Yeah. And withdraw mid-competition for such a reason as well. No, it's interesting. It really is. I was having a conversation about the fact that we can talk so openly about mental health.
Yep.
That someone who is seen as so strong and so dynamic and literally in the top of her game, to be able to acknowledge that simply put, she was not in the right mental state to complete the competition, and took the decision, because that's one step, recognizing that, I'm not where I need to be mentally. As we often make physical assessments of how we feel. You wake up in the morning, you say, okay, I don't feel well.
Yep.
I have a cold, a cough, or whatnot, and I'm not going to go to work. But the step mentally, to be able to acknowledge that mentally you cannot be able to perform at your best, and also saying, I won't because of mental health reasons. That's a whole different level of bravery, especially in today's world, because when we acknowledge mental health, it still is a touchy subject.
Yeah, and not only that, but to make the decision when millions and millions of people are going to be watching, and people are going to be criticizing as well. And we saw this recently, sort of, with another athlete, Naomi Osaka, the tennis player, of course, and she withdrew from the French Open this year, and she didn't participate in the Wimbledon tournament either, for the same reasons. And I think that it's also, there's a growing recognition of the fact that, your mental health is just as important and valid as your physical health. And if you're physically unable to do something, you know, for the use, just like the example that Marlene gave earlier, you know, you're not able to go to work because, you know, you feel sick, you have a cold, or you have a stomach problem. And of course you can't go to work because you'd be distracted, you'd be dealing with pain, and you surely wouldn't be as productive.
Yeah.
And the same, of course, obtains when you think about it mentally, because if you're struggling with something mentally, whether it's anxiety, whether it's, you know, even something that has affected you recently that's just taking your mind off the job or whatever it is that you have to do, recognizing that fact and saying, yes, I'm going to actually take the time off and I'm going to do it is huge.
Yeah. But it's not without criticism.
Yep.
I mean, you know, I've seen some reports where people are calling her selfish, where some people consider it to be a very weak move, that athletes of that level should in fact be aware and understand.
And that it's part of the,
that's
it's
what they part say, of the competition.
You know, when you get to that level, part of it is the pressure, but I think that you know, going back, it's like any job. I think that of course, the more successful you get, and the more attention you get for that, it's going to be more pressure and anxiety the closer you get to the top. But I think it doesn't make a difference if you're unwell, then you're just unwell. And
I appreciate you saying that. I think, yes, there is, and I'm sure, because she's performed under pressure every time she gets on that floor or into one of her events. So I'm pretty sure that as she's grown as an athlete, she has been able to deal with the pressure, but that doesn't mean that there isn't a point where it becomes too much. And you know, she said it in her press conference. She's like, I am human after all. And it doesn't matter what dynamic ability she has an emotional health and a mental health, and of course her physical health. No one would have bat an eyelid if she had, you know, twisted her ankle.
Exactly, see?
They would have said, okay, yeah, of course, you know, and she has to sit that one out.
Yeah, and when you think about gymnastics, the margin of error is so tiny that, you know, if you're distracted and you make one wrong move, then, you know, that could mean a broken bone or a sprain or something, and that will, of course, affect her in her sport for the rest of her life. So, you know, taking the step to protect your mental health, to ensure that you're in the best form possible to be able to compete, I think is really wise of her. And I think that the growing recognition of mental health issues is something that's really positive. And I hope that it continues and that it spills over into other aspects and professions, and it makes us, and it's making us have the conversation.
I mean, we're talking about it here, and it's not or Olympian, but it is something I think that has sparked a debate once again on the issue. Far more people are understanding, though. I will say that much. Far more people seem to be empathetic to the fact that it is completely understandable that she would be able to acknowledge that she was not mentally fit to be able to complete the competition. But as I said, there are some who are still calling it out, who don't understand it or don't want to understand it.
Yeah. That's a whole other issue when you talk about people who don't want to, of course. But there is a lot to get into this morning, and on this related issue of taking care of yourself, we've got some motivation coming up for you.
That's right. And so that means it's time for our eye opener. And our eye opener, taken from dailyom.com, goes like this. To label yourself as good or bad is to think too small. There's no such thing as a good person or a bad person. There are choices and actions that lead us in different directions. And it is through those choices and actions that we create our realities. Sometimes we choose or do something that takes us in the opposite direction of the reality. When we do this, we feel bad, uneasy, unhappy, unsure. We might go so far as to label ourselves bad when a situation like this arises. Instead of labeling ourselves, though, we could simply acknowledge that we made a choice that led us down a particular path and then let it go, forgiving ourselves and preparing for next opportunity to choose and act in ways that support our best intentions. If you find yourself going into self-judgment, try to stop yourself as soon as you can and come back to center. Know that you are not good or bad. You are simply you.
It's a nice message, and I think it's, of course, a very true one. And everybody is complex and has parts, good and bad, and nobody can be completely one thing. And I think that we have to recognize that fact for ourselves, even when we make mistakes or when we do make bad decisions, that it doesn't, it's not 100% fatal and you can never recover. So I think that that's the message that the eye opener is trying to get at, and I think it's one that we can definitely use when we do get into self-judgment and when we judge ourselves too harshly. I think that you have to realize that everything is not the end of the world, and that maybe even if you do make a mistake, it doesn't mean I'm a bad person. So if you do feel bad about it, maybe you'll be in a position to fix it, or maybe you can move on, or you can apologize, or do whatever it is that has to take to make you take that weight off of yourself. So yeah, of course, nobody's 100% good or bad.
Yeah, I think a key message is kind of just pay attention to the things you tell yourself. It's so important. And if you think about it with children, when we typecast them when they're very young, oh, this, that, a bad one, this, that, the troublemaker. A lot of times you find out, imagine what you're telling these children. You are labeling them as to what they are and all that they can be. And that's one thing. And I hope that people are now at the point where they realize that it is important to recognize the difference between a behavior and between who someone is. And it's the same kind of understanding that we have to have for ourselves. We make bad decisions sometimes. We make bad decisions that may impact us directly. We make bad decisions that may impact other people. But just because you make a bad decision doesn't mean that you are inherently a bad person. And oftentimes, if you have that guilt and that sense of remorse, it means that you actually do have a far more caring outlook towards others than this action actually makes you look like. So it's literally the things we tell ourselves that can help us recover from mistakes that are made, and that can help you in the future decision making, so you don't feel like you are doomed down this particular path.
Yeah, exactly. And I think that I really like the example that you gave of children, because of course when we do start labeling people as one thing, then it starts to affect their mental process. So if we say somebody's a troublemaker and they're known as that, or they know that people think that of them, then of course the decisions they make are say, well, this is the expectation of me in any event, so why don't I do it? So, when you evaluate yourself and you think about yourself as good or bad or whatever it is, try to think about that in the same way and realize that, there's always room for change and growth, and that, everybody's complex.
That's right. Okay, and with that, we're going to get moving into our weather update for today to find out what we can expect. And our general situation for this morning is for a gradually improving conditions expected for today, while a relatively moist air mass prevails over the area.
And for our 24-hour forecast, we are expecting it to be cloudy at times today and partly cloudy tonight. Showers or thunderstorms will be isolated today, with a few more developing over the southern districts tonight.
All right. Our winds are going to be moving from the east at 5 to 15 knots, and our sea state is going to be choppy.
And looking at our temperatures, we are expecting it to get up to 90 degrees Fahrenheit along the coast, 94 inland, and 78 up in the hills for our high temperatures.
Tonight it's going to be 81 along the coast, 75 inland, and 66 in the hills.
And our outlook as we head into Friday, the beginning of the long weekend, we are expecting generally isolated showers and thunderstorms on Friday. Then a few showers and isolated thunderstorms will develop and occur mostly over the southern districts on Friday night, with isolated activity elsewhere.
All right. So that's our forecast for today, courtesy of the National Met Service of Belize. And we want to say thank you to our forecaster, Crystal Rosales.
And that is our weather for this morning. And we can jump right into talking about our show because, of course, we've got a lot of great conversations lined up. Our first conversation is going to be speaking about COVID-19. Of course, there have been some concerning numbers as the cases continue to rise, and we are also seeing the concerning situation where there have also been recently COVID-related deaths. And so to put all of that into context, we are going to be having our first conversation with Dr. Laura Friesen, and we're going to be speaking once again about the virus, the ways that it can be transmitted, as well as the vaccines. So that's our first conversation for this morning.
The second part of our show, we're going to be joined by the Coastal Zone Management Authority. They're going to be talking about an update that they're going to do to the marine habitat map. It's actually 2 decades old, so clearly there's going to be a lot of updating to be done. We'll hear more about the process from the representatives of the CZMAI.
And finally, we are going to be hearing from Caring for Corazon, and they're a group that is spreading awareness and is actually started some really great initiatives that are focused on caring for animals. And so that's going to be our final conversation for this morning.
All right, so that's what we have in store. We're going to go ahead and take that break. When we come back, we'll get right into our first conversation. So please, stay tuned.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
It's a fact that with Smart, you get truly unlimited everything. Only with Smart, you get unlimited data anytime. While with the other guy, it's only double data on weekends. With unlimited data every day with Smart, there's no need to wait. So, it's a fact that our unlimited plans beat the competition. Stop being measured and told when to use your data and get unlimited talk, text, and data. Experience the true unlimited plans with Smart. That's a fact. Make the switch and live smart.
Introducing Edam A cheese, the A+ Dutch cheese to hit the Belizean market. As the name says, it is of A-class quality, the best Dutch cheese in Belize. Edam A cheese is creamier, less salty, and simply more delicious. Don't be left out. Get your A cheese at a supermarket near you. A cheese exclusively distributed by Unitex Company Limited. Call us at 610-3626 or 610-8910. Follow us on Facebook at Unitex Belize.
Whether you're at home, on the road, at work, or at school, if you see news happening or suspect that something might be up, call or text the Channel 5 News Belize tip line at 672-5555. You don't have to give us your name, just give us the tip. That's 672-5555. Call or text us so we can check it out.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And we are just getting our first conversation for this morning started. And as we said before the break, we are bringing you our COVID-19 update, and we are going to be talking a bit about the current situation in Belize. And joining us for this conversation, we have Dr. Laura Friesen, who is a general practitioner at the Belize Medical Associates. Good morning, doctor.
Good morning. It's nice to be here this morning, bright and early with friendly faces.
It's definitely nice to have you. Thank you for joining us. And so, given the recent numbers, we've been seeing an increase in cases as well as deaths. And can we just start with sort of what your reaction is as being a medical practitioner from seeing what the current numbers are in Belize?
Well, it definitely causes concern. We have been through one wave already. That was pretty bad, and we saw effects on the community level, individual cases that I can name off the top of my head. We saw the country, what it went through, the healthcare system, and it's reality. It's a reality we have to face, even though maybe we do not want to face it. But it does seem that we are going into a bit of a crisis again. And also looking at how other countries, how their numbers have gone. So it would be unreal to think it wouldn't happen to us. And so I think for right now, the message is just what can we do to stay as safe as possible, and how can we prevent people from getting very sick and dying.
And I was just going to say, just to ask very quickly, in your experience, let's just say day to day, have you also been seeing those that reflected as well in your work? Have you seen perhaps some greater cases coming in, or greater cases of concern, I should say?
Yes, for sure. We have seen the jump, especially here in Belize City where I practice. We have had a huge explosion of cases over the last 2 weeks. We have seen cases where I work at the clinic, or respiratory cases have been increasing over the last few weeks. And so it's definitely something that we see reflected on our clinical practice. We also have patients coming in telling us about their family members who are sick as well. So we do see the effects of it starting to happen in the community. They're not asymptomatic cases. Many of them are symptomatic, and some of them have been getting sick. So that is definitely something that we have been seeing.
Dr. Friesen, yesterday's report that came out, we saw the largest number of new positive cases detected in Belize City. You work at the BMA NHI clinic in Belize City, and so you have patients coming in on a day-to-day basis. Do you feel that there is the same level of awareness and sensitivity and precaution being taken from the patients that you're seeing?
Compared to?
When we weren't in this particular wave. Like, is it less or more than last year?
I feel like persons are just now starting to react. I feel everyone was kind of a bit complacent, maybe I should say. Even myself, over the last few months, everyone wants to go back to normal. Everyone wants to get back that human contact. And so it's a little bit hard to balance the need for human contact with the need for safety. Mm-hmm. And so I do feel that there has been some complacency in the general public and people I come in contact with. But I think now we are seeing some persons start to become more conscious again of where we're going. Yeah. It's always hard because as doctors or as people who study public health, we look into the future predictions. So we see these things coming on, and the general population might not see them coming on until it's happening to them, to their own family. Mm-hmm. And so a lot of times we might be talking and talking and talking, mm-hmm. and someone else might not see that risk as we do, because we focus on the medical side of things, on the clinical side of things, and we have seen how bad things can get. And so it's a little bit of a play with risk. How do we interpret risk? That's one of the main things as well with vaccine hesitancy. Mm-hmm. What is my interpretation of risk of catching COVID-19 virus and what is my risk for actually suffering the consequences of COVID-19 compared to what are the risks of taking the vaccine. So that's a lot of, those numbers have to be analyzed, and they are being analyzed by doctors and scientists, and I look at those numbers as well to best educate my patients as to what is your risk of getting the consequences of COVID-19 and catching it versus what is your risk of getting the vaccine. And so far it's been far on the side of getting the vaccine, especially for our older population and our population with any kind of comorbidity, and that includes obesity as well.
Tell us a bit about your experience with people who are vaccine hesitant at the clinic.
Well, I try to explain and give information.
Do you see them?
Oh, they come in all the time, but I am very encouraged because many of them come with questions. Many of them come for a general checkup. We have identified new diabetics, new hypertensives. People are coming in, they're asking for a checkup. People want to be healthy, and that is encouraging for me. Because they are coming in and asking questions. But one of the main things that I try to explain is we would all love to go to a world that doesn't have COVID-19, especially as a doctor. I would love that. But right now it doesn't seem that's going to happen in the near future. So what are our two options? Well, there's three options. You go live as a hermit in the bush and not have any contact with any person for the next probably 4 to 5 years. That's option number one. The other two options for normal people would be, number one, you get the vaccine, you take the risk of getting the vaccine, but also the protection that comes with it. Number two, you don't get the vaccine, that's option number three, actually. You don't get the vaccine, but then you also have the risk of the virus, of catching the virus and the side effects. And we have seen now with the rapid spread of cases and the probable presence of Delta in the country, even though we don't have confirmation of that at this time, is that everyone is going to be in contact at some point in time. It would be illogical to think otherwise. So this is your choice, right? You want to take the risk of getting the vaccine, you get the protection. You want to take the risk of getting the virus. We have a poor healthcare system. It's often overwhelmed. It gets overcrowded very quickly. You want to take that risk. That is also, you can also choose that risk, but that is a much higher risk for you at this time, especially seeing the explosion of cases.
And what are some of the concerns that people have about getting the vaccine? Because you say they come in and they want to be healthy. Someone going to a clinic means they want to protect their health.
Yeah.
So why is it that they find it difficult to be convinced to take the vaccination?
I think there's a lot of misinformation out there. There's a lot of persons that are sharing information maybe for the excitement that it causes and not necessarily for the veracity of the information. That is unfortunate. I think even as doctors we should not motivate by fear but rather by information and by caring for the population. So that is a big thing. Facebook videos, YouTube, there's a lot of misinformation. A lot of persons look at statistics, manipulate them, and say them with fancy words so people don't know that they are not speaking the truth. And especially our elderly population doesn't really have that access and that savviness with technology to actually go and look for real information themselves. And so they're relying on their neighbor and the WhatsApp video that someone sent them, and these might not always be good sources or true sources. And so that is one big thing. Of course, there's always the whole thing with the risk. The media has run away with some of these blood clots at certain points in time. There is a risk. They have identified a risk of certain types of blood clot. They remain very rare, but it is there, and I inform all of my patients of that. Actually, if the whole country, I crunched some numbers last night because I was getting ready, and if the whole country of Belize would get vaccinated, I counted a population of 400,000 persons. You would have, at the most, with the current statistics, and these come out of Europe because Europe has used the AstraZeneca the most, we might have 2, at the most 4 cases in the whole country if 400,000 people would get vaccinated. of a blood clot, and not all of these end in death. So these can be treated, right? That's not a lot if you look at it at a population level. Your risk of any kind of thrombosis having symptomatic or asymptomatic COVID is up to 25%. And so if you get COVID, even if it's asymptomatic, you have a much higher chance of blood clot at any point in time than you ever get. At this point, the data is showing that you would have any risk from the vaccine. Also, contraceptives have a high risk of blood clot. We have many patients on them, and the risk for blood clots with contraceptives is actually higher than the vaccine. So it's all about how do you interpret risk. A lot of times we don't understand how to interpret risk, so therefore we can't understand the information that is given.
Yeah, and I think you speak of the side effects, the potential side effects of the vaccines, and it's important that we say it. It's important that we help people understand that, yes, everything that we put into our body can have potential side effects. And it doesn't mean you're going to get it, but it means that you may.
Yeah.
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 Now, the other issue I wanted to talk about was looking at the variants. And you have been very vocal online. We know you've been trying to get education out to as many people as possible to help all of us understand just what's happening with the different variants. Let's talk about those. What we know about the variants of concern so far.
Okay, so there are, by now, I think there's probably about 7 to 10 variants of concern. I'm not an epidemiologist, so I will just explain in simple terms. It's one of the first variants that was identified was Alpha, which was coming from England, which was identified first in England. And then that kind of gave them, I think it was their second or their third wave. And then that was, I think, around the end of the year last year, and then beginning of this year we had the huge wave in India, and that's where Delta was first identified. Now if we just want to bring it into focus, the original COVID-19 virus that was responsible for the first wave in most countries had a certain level of transmissibility, and that means how easy it is spread from one person to the next. And when we looked at Alpha, which was the kind of the first major variant that was, responsible for the first major outbreak, that one showed around 50% increase of transmissibility, meaning that it spreads much faster, much easier, and Delta is now 40 to 60% more transmissible than Alpha. So it's basically 100% more transmissible than the original variants, meaning that your risk of getting infected from another infected person, like let's say you're sick and I'm sitting here, me getting sick from you would basically, my chance is 100% more if you would have Delta than if you would have the original variant. So that means it spreads much faster in workplaces, much faster in homes. The viral load is actually I'm trying to remember the exact number, 100 to 1,000 times higher in Delta patients, even asymptomatic. However, the vaccine does reduce that drastically, even if you have a breakthrough infection. So that is another reason to get the vaccine, because it reduces your viral load and makes you less infectious, majorly less infectious to other people.
Yeah. And Gamma is the one that originated in Brazil that can affect children.
Well, all of them can affect children. But yes, Brazil had a particularly unfortunate wave. I think this was, I'm trying to remember which month, but they had actually at one point in time, their average age of persons in the ICU was around 40. Which is, if you think about it, that's a major thing, because in the initial wave, mostly 70, 80, and 90-year-olds were dying. And to have the average age of an ICU being around 40, that is major, because that means half of your people are under 40 and the other ones are over. So they went through a particularly, that had social and political factors as well, not just the variant. So we cannot always compare exactly what happens from one country to the next, but it is something to be, careful about, and to make sure that we are doing the best we can for our own health so that we can avoid those types of situations.
And I think earlier you had said that that Delta is probably here by now. And is that based on what you've seen in terms of the clinical, or just based on what you had also said earlier about your the assessment of risk based on the numbers and stuff that you're seeing?
Well, I mean, I'm saying that, like I said, I don't have the proof of that, but U.S. has 80% Delta cases right now, so I think it would be rather naive of us to think that that hasn't by now traveled to Belize. And we have seen a pretty explosive spread where whole households and whole workplaces end up, you know, with positive tests because it spreads so quickly. So we're seeing it both in the epidemiological trends and just knowing that the U.S., which is one of our closest neighbors, and there's a lot of traffic up and down, it would kind of be, you know, naive of us to think that we haven't at least have some cases of Delta in the country. And because it's much more transmissible, it is very likely to have already become the dominant variant in the country.
So, you know, when we had the first wave of COVID-19 in the country, and even the second, when we were, I guess, battling the original COVID virus, there were some guidelines that were given to us, and I know they were used for contact tracing as well. One of them being, how long were you without a mask from another person who was also unmasked? And I know there was a criteria, I think it was 15 minutes of exposure. With
cumulative.
Yeah, cumulative. So it was like if it was 5 minutes, 5 minutes, 5 minutes. Now, with the high transmissibility of Delta, what are some of the new precautions we need to be taking as we interact socially with others?
Okay. Well, there again, this has to do with the amount of vaccinated individuals as well. So one thing, the 15 minutes, it's kind of arbitrary number. It was just as a guideline for, you know, how do we break it down to people to kind of explain to them that, that a time of exposure is equal to risk of infection. So that 15 minutes is definitely not quite like that anymore. We have seen people that get infected just with being in the same room, just passing through, or having touched someone, or you know, having had one face-to-face contact and then leaving. So because of the high viral load of the Delta variant, and so this is something that we have to adjust. I think as we get more vaccinated individuals, hopefully it doesn't mean we have to even be more socially isolated, because it does have mental and, you know, psychological effects as well. And so I think just as a precaution, keep wearing your mask, look at your surroundings, make sure your surroundings are well ventilated, make sure that you're cleaning your hands. Hand washing is a major thing. Make sure that you're not going into crowds. Crowds tend to be quite dangerous. I have mentioned in my post, workplaces with their lunchrooms are the best place to get COVID-19 because no one's wearing a mask and everyone's touching their face and their food. And so it's you know, it's all about your risk factors and what risks you are willing to take and put yourself and your family in, right? So that's basically.
The CDC in the United States earlier this week advised that in states where there were a high spread of COVID-19, that in fact people should resume mask wearing indoors.
Well, I mean, that is, like I said, that has to do with epidemiological control. Like, how do you control an outbreak? Remember that with the Delta virus, we have the vaccine efficacy is slightly less than original. It's still very high, 60% risk reduction for symptomatic infections, and over 90% risk reduction for severe and illness and death. So we're still very, very effective vaccines. However, we do have this, so if it reduces your risk by 60% for symptomatic infection, you can still have those people that are the breakthrough infections, that are the ones that get either asymptomatic or mildly symptomatic cases. And so if you have too many of those, and with Delta being much more transmissible, you could end up with a huge outbreak on your hands because of the explosiveness of this. And that is, I imagine, why they went to that again, because many of the states had already kind of, you know, laid down the whole mask thing for right now. But it has to do with risk factors for each population. Again, we can't compare the US and Canada with Belize. They have ICUs. They have a lot of resources in the country. For me, if my mother gets sick, what do I do? Do I have money for her to go to a private hospital? Do I want her to go to a public hospital? Are there spaces in the public hospital? These are all things I as a doctor think about, and sometimes we don't think about them until we get sick. And so there's a little bit of difference as well. That for me has a big thing with the risk as well. US and Canada, they have a lot more resources. Their countries are larger. They have bigger economies. They tend to be able to handle surges better than we do because of just our level of resources in the country, basically. So that's something to be, concerned about as well, and something that hopefully we can learn from this pandemic, that we can start to strengthen that system more and allocate more resources to health, both on an individual level and on a country level, right? Because it's important as an individual as well. Everyone has that opportunity in their own life to be more healthy and to exercise and to have a healthy diet, which will help them, whatever happens.
What's the type of interaction that people who are, like if your family is vaccinated, how do you interact with them?
So one thing that has not changed, maybe I should start with that, is that if there's anyone with flu symptoms or fever, they should not be in any public place. It doesn't matter if the fresh cold, the wali allergy, that I get wet last night, it doesn't matter. If you're sneezing and coughing and have sore throat and fever, you stay at home and you stay isolated, because that is one thing that people have been kind of getting I've noticed people getting a little bit more lax about.
That is so true. Yeah.
Oh, I just have wali flu, or oh, I just get wet last night. And that's
allergies, which have been really bad. I'm guilty, yeah.
Well, and if you know your body well, you can usually tell when it's an allergy and when it starts to get infectious.
Yeah.
But that is something that I really feel the need to highlight. Vaccinated or unvaccinated, we should be conscious of our infectiousness, because even other respiratory viruses are very super infectious. So it doesn't really matter, be it COVID or flu, why should you be spreading it around to your family and friends? That's one thing. The other thing is, once the members of the family are vaccinated that are at risk or that have more exposure to other persons, I would say that some of the guidelines could be relaxed a little bit, depending on what your original ones were.
Yeah.
But I still advocate for ventilated spaces, good hand washing practices. They should be part of our life. It doesn't matter, be it COVID or not. Washing your hands saves you from a world of ills. It's not just, we're not just preventing COVID here, we're preventing, parasitism and all kinds of other viruses that we can get through food and through contact with other people. And so, official guidelines, I'm not sure about that, and I guess it has to do with with what is your risk and what is, and also who are your family members. If you have very high-risk family members, your behavior should be different. For example, if you have cancer patients, people in your family that are cancer patients or that are elderly over 70, you should continue to be careful, because they could still get sick.
Even if they're vaccinated. So if I have an elderly mom and she's vaccinated and she's in the household, she may stay home and be isolated, but everyone else goes to work. So you still have to have that level of precaution, like we did back in March and April last year.
I would say if everyone is vaccinated as well, then there is a lower risk.
Yeah.
Like if all of your family members that come into the house are also vaccinated, because the vaccination does decrease your viral load if you would get infected, and it does reduce your risk of getting infected. So it does very much decrease your risk. Of course, there will always be those outlier cases. There will always be, and we can't really
be the exception to the rules.
But to stay sane, I think once we have the family vaccinated, I think that we can start to decrease a little bit on those.
You said something, and I think we really should take the opportunity to explain it. Last year, we were looking for things like loss of taste and smell and fever. Those were kind of the first signs for, and we were actually told things like runny nose and sneezing probably wasn't COVID.
Yeah.
But that's changed now, right?
Yeah. This information actually comes from, I believe it's an app that was just collecting data, population-wide data in Europe and in England while they were dealing with their Delta wave. And they noticed that people were more reporting headache and runny nose and body ache and fatigue before they were actually reporting fever, loss of taste, and cough. And so this is important. Why? Because this means that, I mean, in the beginning, especially when we weren't even sure what we were dealing with, the major, information campaign was, if you have fever and a cough, then you stay home.
Yeah.
It wasn't even if you have fever or a cough. If it was if you have fever and a cough, then you could be infected. And that has changed now, where a lot of our mildly symptomatic patients have symptoms that would favor a flu much more than before. So before it was more like, oh, you probably have a flu, but you have like a dry hacking cough with a fever, so you're COVID-19. You have that diagnosis. But now it's more of, okay, anybody with the flu symptoms could potentially be COVID-19, or might probably be at this point, especially in Blue City. But that is something to remember, and also just realizing that if you have risk, or if you have had exposure to COVID-19, then it is probably COVID-19 if you start with symptoms. And so it's important to be quick with your testing. Doctors work better with facts. We want to know what we're treating. We can treat you better. We don't do very well with guessing. We want to know what's happening. That's why we do tests. That's why we examine you. That's why we ask you to come in if there's a problem, because these things help us to save lives. They're not just fun for us to swab people. It actually saves lives.
And percentage-wise, one of the things that I had wanted to ask earlier when we were talking about variants is that when we look at symptomatic versus asymptomatic cases, do those numbers still look sort of the same to when we were just starting to sort of learn about the pandemic? Because if I recall correctly, we were looking at numbers that the asymptomatic cases were significantly higher than the symptomatic cases.
I would not be able to make a very informed statement about that, especially because right now we have the variable of vaccinations in there, and so that has definitely increased the amount of mildly symptomatic people. For example, in England, they were dealing, or are dealing still, with a huge wave again of Delta, but by now their mortality and severe hospitalization is very low compared to what it was in their initial wave. And so there will be data coming up in the next couple of months that will bring into the picture those kinds of variables. But I couldn't say right now what is the exact percentage. But we still see on a worldwide level, that is reported cases and reported deaths, which we often know are very far from the actual deaths and actual cases. That the mortality rate is still around 1%, which is 10 times higher than for normal influenza. So it still hasn't kind of budged from there, even throughout the whole pandemic so far, but maybe with vaccines, hopefully, and with improved treatment and more awareness, that will start to go down with time. That is our goal, for that to start to go down, that 1%, right?
Yeah, and that's such a key point that we don't talk about very often. Our mortality rate in Belize is higher than the global average of 1%.
Yeah, well, that might be one of the reasons might be because we have not always been ahead of the game with our testing, so many of our mildly symptomatic and asymptomatic cases might not have been detected. And also it has to do with our resources on a hospital level for the cases that do get severe. Is there enough oxygen? Is there enough ventilators? Are there enough healthcare workers? Because that has been an issue as well. You can't just have 6 people on ventilators just sitting on the beach. You have to have nurses that are taking care of all of them, and if we don't have that level of that amount of nurses to give those persons the care that they need, then of course we start to run into problems, right? And so I think that might be part of it, but there's definitely many different factors.
I think you said it earlier, and I think it's perhaps a perspective we haven't looked at. Do you want to risk taking the vaccine, or do you want to risk trusting whatever is available in our healthcare system? Private if you can afford it, and I don't know if people know how costly it can be. private care for COVID can run you into the hundreds of thousands of dollars. And whether there is space available in the public health system.
Yeah. Because there was a moment in the last wave that we had, October, November, December, where public and private hospitals were pretty much at capacity or over. And so that, with a new variant that spreads faster, that is always a blink away. You know, it's always something that we pay attention to.
How do you, in the clinic, address I mean, when you talk about symptoms like a runny nose or a sniffle, we're going into the rainy season, people get sick very easily, so I would very easily dismiss a runny nose as my allergies, or maybe I caught a cold. How do you, when people come in, do you automatically assume it's COVID-19?
No, we always look at all the risk factors. We also look into social factors. For example, is this person going back into a workplace with many colleagues? That makes my level of suspicion, or not suspicion, but that makes me much more careful. If this is, you know, someone who stays at home, I might say, well, let's monitor you for 2 or 3 days, and if you have no elderly around you and you will not leave your house, then we can monitor you and see if you develop any further symptoms. But we do a lot of risk evaluation. That's why being a doctor is not so easy sometimes. We look at every individual case and we see what are the social factors, what are the biological factors, is this person at high risk for complications. And you know what, testing is not such a big deal. It's better to know that you're negative than to be walking around and wondering, am I spreading it to my neighbors? Am I spreading it to my mom? You know, I want to encourage people to come to the clinic if they feel like they have any symptoms, and not wait and just say, oh, well, I'll go to work for 5 days with a sore throat, and then you come in and you're like, you were at work for 5 days already with a sore throat and fever? Like, what? Like, come on, like, you should have been at the clinic on the first day. Why? First of all, you get tested faster, so you know if you need to be on any treatment. Second of all, if you're going to be going to work sick, you're going to stay sick longer. And so the employer loses, you lose. You're miserable at work for 5 days because your body needs rest to recover and it's not getting the rest. Be it COVID, or be it a flu, or be it a runny nose or a common cold, whatever it is, sometimes taking 1 or 2 days off is prevention for everybody. It helps you get better because you rest. It helps your employer because you're back at work faster, and it helps your colleagues because you're not spreading them anything, be it whatever respiratory infection there might be around at the workplace, right? So that's just, my encouragement as a doctor. I always encourage my patients, come in early, take a couple days off, take care of yourself, drink lots of fluids, and get tested, and then we can move on with life.
Yeah. Let's talk about the breakthrough infections and what we know so far. I know of people, even here in Belize, that have been vaccinated and test positive. And there are two levels. There's first dose and then getting positive, and then the second dose and getting positive. What do we know so far?
So the first dose doesn't really provide you with a lot of protection. It's around 30%. The AstraZeneca seems to have a bit of a slow effect where it takes a few weeks for your immune system to get going. So one dose is about 30% protection, which is something, but it's minimal if you're talking about being in a workplace with 50 people, or or going to a social event, or going to places where safety measures are not in place. So for anyone who has had one vaccine, basically act like you don't have any. That would be my advice. And then once you have your second vaccine, the maximum efficacy is 2 weeks after. And so you should still maintain maximum precautions up to 2 weeks after your second dose. And even then, as long as we have surging virus in the country, the surging virus, everyone is at risk again. And that's why we want people to get vaccinated, because we want to get out of that surge. Once we get out of that surge, your risk of a breakthrough infection will also decrease greatly, because there won't be as much exposure around you. So in general, we're looking at, yes, individual risk reduction, but we're looking at population risk reduction, because it's not just what will it do to me if I get it, but how many people are getting it that increases your risk.
Now, if I'm fully vaccinated, I am fully vaccinated, and I come in contact with someone with COVID, I know one of the reasons some people say they won't take the vaccine is that, oh, well, you can still get COVID even if you're vaccinated. What's the difference for me and the likelihood that I get symptomatic or severe COVID-19?
Well, that's numbers we were talking about. Again, you have 60% less chance of getting symptomatic COVID and 92.
If I'm exposed, I'll most likely get it?
No, you still have 60% reduction of actually getting any kind of symptomatic infection. Okay, so you would have 60% reduction of risk. So this doesn't mean 60% of people will get COVID and 60% of people will not get COVID and 40% will. This is talking about risk reduction for an individual. So 60% risk reduction for symptomatic as a fully vaccinated person.
Okay.
Even if it's Delta. This is already Delta numbers. Okay, with the other variants, it's actually a little higher. I mean, with the original one, it's actually a little higher. And 92% reduction of risk for hospitalization or death, or severe COVID, in other words. And so there is a major reduction in risk. Of course, there is still some risk.
Yes.
But it's quite a bit less than where we started off in the beginning of the pandemic, and quite a bit less than even where we were at the beginning of this year.
So if I get exposed to a person with COVID-19, I may get some of the symptoms, but I'm most likely not going to end up in the hospital.
That's right.
Okay.
That's right.
Now, we do have some questions coming in from our viewers. One person wants to know if they can donate blood after they've been vaccinated.
Yes, I actually have donated blood myself already. There is not a contraindication. I believe the blood bank is asking for you to be, I want to say 2 weeks, but don't quote me on this. So they are asking you to give a little bit of space between your last vaccine and your blood donation. But for sure, you can donate blood after you got the vaccine. That does not change anything in the structure of your blood.
Yeah, and you should give blood anyway, because we always need it.
There we go.
Yeah.
Yes, encourage everyone to give blood.
Yeah. And the concern for children is one that we don't get to talk about enough. We know there's only one vaccine approved for children so far, Pfizer, which we may get, and the Minister of Health is saying that they may roll out with children. But how much should you be protecting your children? Because originally we used to consider them to be safe. Their body was resilient to the COVID-19.
There is still, the risk for children is still actually quite low. Sorry. The risk for children is still actually quite low. There is, of course, some, and the new variants that do seem to have been affecting a little bit more the younger persons. But the general risk is still low, but this is again where the whole population risk comes in. If the whole country has Delta, has COVID at the same time, there are gonna be sick children. There are gonna be a couple that end up in the hospital and maybe end up in the ICU. That's just inevitable. But if the surge can be controlled, then as soon as the level of infection in the population goes down, the level of risk for children also majorly goes down, because their risk of death and severe illness is much lower than, for example, someone who's 50 years old. So it tends to go up really exponentially after like 50. Like after 50, the risk of death and severe COVID goes up. Like with each age range, it goes up kind of very, very quickly. And so there is still, I still, like I said, be careful with all symptomatic infections. Schools hopefully will put into place some safety measures if they are able to go back into classroom now in August, and I hope they will. But the risk for children is low. It is there, but it is quite low, and so it's all about balancing that out with population risk as well. So I'm not an epidemiologist, but I'm just trying to explain a little bit about your question.
Yeah. And just, on a personal level, as a frontline worker, what is it like for you seeing the cases surge here in Belize City, hearing the vaccine hesitation, knowing some communities are completely being unsafe? What is it like for you on a personal level?
it's a little frustrating. I think I also have COVID fatigue. I mean, I'm just tired of this. You know, I want this thing to be over. But at the same time, I have learned, or I'm trying to learn, to be patient and give information as much as possible, because I believe that if people are able to understand, they will make a good choice for their health. And so I think a lot of times it's cultural factors, social factors, it's misinformation that is preventing people from making a choice for their health. So personally, it's of course something that I do feel concerned about, and that's why I do try to educate as much as I can.
Yeah.
It can get frustrating, I will say that much.
You've lost patients.
Yes, I have. We have lost patients at the clinic, and we have, you know, I have lost, you know, family members have lost loved ones. You know, there have been many cases of loss over the last year, and sometimes it's frustrating to see people not recognizing the loss of someone else, and that strikes me as particularly cold. I will always grieve the loss of someone, even if I did not agree with that person, or even if I don't understand what happened. But some persons seem to be diminishing the losses of people who have lost loved ones to COVID, and that is what I think personally is hurtful and damaging to our society.
We have another question here, and this is asking about lactating moms, if they should get the vaccine.
There is no contraindication to lactating mothers to get the vaccine. So if you're breastfeeding, you should be able to get the vaccine. There haven't been any evidence of side effects in the child. And so that is something that I would encourage you to do, especially if you're working or in a situation where you do have risk, or live in a household with higher risk family members.
Yeah. Now, let's just close out for me. And my final question is looking at treating COVID-19 at home. If someone does get COVID-19 and they have mild symptoms, is it as what we saw before, where you have to be closely monitoring your symptoms because it can take a turn for the worse very quickly?
Well, that all depends on your comorbidities and what's your level of general health. Yes, you should be monitoring your symptoms. I mean, you don't have to be checking yourself with a thermometer every 15 minutes, but it's good to have a thermometer in the house. If you do start with more severe symptoms, it's good to have a pulse oximeter in the house. It's good to get your checkup at your local clinic so that they can check you and make sure that there's not signs of any, early signs of any complications. Of course, the paying attention to what's happening in your body is something, as a doctor, that I always advocate for. A lot of people don't pay attention to what's happening in their own body, and so that's something that I really advocate for, because I want people to make healthier choices in general, not just with COVID-19. I want them to realize what they're eating and how much they're exercising and what kind of lifestyle choices they're making that are actually bringing them to the point where they have higher risk for COVID-19. That's also, that's important as well.
Yeah. If you don't mind, if we could take just 5 minutes to answer some of our viewers' questions.
Okay.
And just tell us, and this one, it'd be good if we address it. It says, burning question, it has been noticed that metal continues to stick on people's body, apparently after the vaccine has been administered. Can you comment on that?
Yes, I will comment on that. So I'm not a physicist.
Yes.
So I actually had this discussion with a couple family members a couple days ago who had studied math and those topics in university, and I asked them, would it be biologically possible for a human body to be magnetized in that manner? And this person was of the opinion that you would basically be your temperature would have to be like 1,000 degrees Celsius for you to actually attain that level of magnetism. So it's not physiologically possible. I mean, don't quote me on this because I really don't have the physics background. Maybe we can get a physicist, you know, on the show. But those videos are most likely manufactured. There's no way that that could physically happen to a human body for them to turn magnetic. I mean, everything has a certain level of magnetism because of just the atoms and the relationship between the electrons and the nucleus. But for that level of magnetism, that would not be possible.
And there's a difference between magnetized and just a sticky body. Like if you're sweaty.
That's right. That's the other thing as well. Yeah.
Okay, and is it...
there is a question that we have if there are any long-term side effects of the vaccine.
Well, there is, so to address long-term side effects, of course, there is a lot to be studied because this vaccine is about a year old now. There is something that we call pharmacovigilance, which is actually the following up of any medication or any medical product post-market or post-use in a population. And so all of the countries that are putting vaccines, especially Europe, they are doing close follow-up of any reports of side effects long-term so far, and they regularly update and analyze all these reports to figure out, is there actually a link or is there not, or what's the risk factor. And so there is not any proof or any biological mechanism for some of the fears people might have so far. And we do know that COVID can have very bad long-term side effects. I mean, you can die, and that's pretty long-term, if you ask me. And so it's all about risk, you know, which risks are you planning to take? And we don't need to only talk about death with COVID. We have patients that have long-term consequences such as stroke, heart attack, thrombosis, because remember, COVID has a high risk of thrombosis, lung damage. There's going to be an epidemic of lung problems in about 10 to 15 years because of all the patients that got lung damage now during COVID-19 but survived but still had the side effects. So we definitely know that COVID-19 has very, very severe and very widely spread long-term side effects. And so when I look at that compared to what we know so far about the vaccine and how safe it appears to be so far, for me, there's no black and white answer. It's about your risk.
How long should I wait after being 1 month after delivering my baby? I guess how long after delivering can I get vaccinated?
Yeah, you can get vaccinated pretty much right after.
Okay.
Yeah. I mean, if you're not going to be going back to work, I would probably suggest that maybe you wait a month or so just so that your body is a little bit more, recovered or a little stronger. But there's not a counterindication in as far as that.
All right. And my son is 13 years old and is asthmatic. Is it safe for him to get the vaccine when it is offered to children?
I cannot really comment on individual cases, and it would be good for them to consult their family practitioner. But of course, the Pfizer one is the one who has undergone the trials, and that's still the safety safety information on that is still coming out and still developing. So that will remain to be seen once it is available and based on advice from the personal family doctor.
Yeah. What's the most common question you get asked by your patients?
I think just is it safe for me? And like I said, we do have many people coming in and asking for checkups, and I'm very encouraged by that because it gives us a chance to address other health issues, not just vaccine or no vaccine, but you come and you get a checkup. That's great because we can look at you, we can see, well, you have these risk factors, this is things that you need to change in your lifestyle, and so that is very helpful. But that is a very common concern for many people, and rightly so. We all even if we don't realize it, we all do risk analysis all day long, every day, in every part of our life with everything that we do. And so it's a part of life, and the more information we can get, the better of a decision we can make.
And just looking at the the question of, I'm sorry, I lost my question there for a second. But we were talking about vaccine safety, and the question that people have about whether or not, oh my God, it's gone. Yeah.
Well, I was just going to ask because as we're running out of time, I just looking at the numbers that we're seeing right now of infections and whatever. I just wanted to sort of round off the discussion by maybe some of what are your predictions as to increases or whatever we might be seeing over the next couple months, and what would be or perhaps we can say what would be the best case and the worst case scenario based on the numbers that we're seeing right now.
Well, again, I'm not the epidemiologist, but right now it can go either way. If we're really lucky and our RO stays, under 1, this wave might be over possibly by September. But if things continue like they are going right now, this could still be exponentially higher than we're seeing right now. And we're starting to see better response for vaccination, but these are mostly first doses. And so these people are not really protected. So as I also mentioned on my Facebook post, is that you can't really vaccinate yourself out of a surge. The vaccinations happening now are hopefully going to prevent mortality and severe COVID in the following wave, as in after this one. But this one, it's kind of already on us. It's kind of already happening. And so we do encourage people to be careful and to be mindful of the fact that the healthcare system doesn't take much to be overwhelmed. It sucks to be poor in Belize, and it sucks to be sick, and it sucks to be sick and poor, and many of us do not have the resources to deal with the kind of consequences that we might face if we're not careful. And so that is just a little bit of a sobering reality that we should keep in mind, and try every day to reduce our risks as much as we can.
I remember my question just very quickly. Masks, the proper masks. I know that some help to protect you better than others. What's your advice?
For general public, if the majority or all of the persons are wearing masks, the basic medical mask it gives you a good level of protection, or even the cotton cloth one, because basically what you're doing is you're preventing the expulsion of virus as much as you need. Now, of course, for medical professionals, we do prefer the KN95 or the N95s, because they do protect you if you are in an environment with high viral exposure. So as long as we have good ventilation, we are not going into huge crowds, and we're not touching up on a lot of people, and the majority or all of the persons are wearing the simple mask, that does seem to give a high level of protection. So there's not really a need to be running out and mask buying the expensive masks, but it does have to do with what environment you're going into. If you're going into an environment where there are confirmed COVID cases, or you're going into an environment where nobody is wearing a mask and where there's very poor ventilation, then of course you might want to step up your risk, your protection level, and wear a mask that's a little bit more, that it gives you a little more protection.
Well, thank you for coming in and taking your education campaign from Facebook to here on TV. But we appreciate it. I think everybody wants factual information, and they want people who can help us understand more about what we're battling with this pandemic.
Yeah.
Thank you. We're going to go ahead now and take a break, and when we come back, we'll be talking about the updating of the National Marine Habitat Map. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor, and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Full-Tech Systems, your technology center, where you'll come for the price, but stay for the service.
Smart continues to expand its internet coverage countrywide to help you live a smarter life.
Our villagers are very happy. They are pleased to know that Smart went the extra mile to put a tower in our village so that our villagers can get live stream on their TVs and they can get their kids doing their online classes. I want to say to Smart, thank you for making it possible for us to get internet in Gardenia Village. We really do appreciate it.
Smart continues to take the internet and mobile services to communities across Belize. Now save even more when you bundle your Smart broadband with Smart mobile services. Smart, bringing people together.
If you have a baby on the way, here is what you need to know about maternity benefit. It includes both an allowance for 14 weeks and a grant, which is a lump sum of $300. The basic requirements are: you must be employed, you must have at least 50 paid contributions, and you must have continuous contributions leading up to delivery. To apply, a licensed doctor certifies the expected date of delivery. The employer completes the salaries record. Submit your completed claim form as soon as possible. After giving birth, submit your continuation claim no later than 3 weeks after delivery. If the mother does not qualify, the father of the child may qualify for the maternity grant. Want to know more about maternity benefit or grant? Visit our website or contact any of our offices to have someone assist you. Also, be sure to visit our Facebook page and give us a like to stay informed. Social Security Board, safeguarding you, your family, your future.
It's time to put your TVs on lockdown. COVID won't stop us this time. After a year of waiting, Summerfest is back, pandemic style. If you're under the age of 18 and you think you have the talent, we are looking for you. Submit videos to us on Facebook, Instagram, and email. Or join us here at Channel 5 on Coney Drive to audition from July 26th to 30th from 10 a.m. to midday. Be a part of Summerfest 2021 and show Belize your talent.
Hey, Dad.
Hi, Brian. Please stop running around the house.
Right now, Dad.
Damn it, Brian! I told you stop it! Can't you hear me? Are you deaf? Are you just being...
Time out. Your life is stressful, and it is easy to lose your patience. When you feel this is about to happen, take a time out. Harsh words are verbal violence and can be very harmful. They are not forgotten. Offering alternatives and communicating with your child is the best way to build real respect. I'm sorry, Brian. That just had a rough day at work. Can you do something quiet?
Do you want a job?
That's more like it.
Conversation for today, where we get to find out more about the update of the National Marine Habitat Map. And joining us for this conversation, we have the director of the Coastal Zone Management Authority Institute, Arlene Young. We also have with us Delwin Guevara, who is the Geographic Information System, or GIS, technician with CZMAI. And we're joined by research scientist Dr. Emil Charrington. Good morning and welcome.
Good morning, everyone, and thanks for having us on the show this morning.
Hey, morning, everyone. Thanks for having us on the show today, too.
Morning, everybody.
Dr. Charrington, you're joining us from where?
Joining you from Huntsville, Alabama, the Rocket City in northern Alabama, where actually we are very pleased to have Mr. Delwin Guevara join us for a technical exchange this week. And just to say, I know that some people are glued to the Olympics, and basically just to say hats off to our colleagues at the Coastal Zone Management Authority Institute. They're like basically the science Olympic team from Belize doing some really great work, and we're really glad to have one member of the team with us this week and the other here in spirit. So thank you so much.
Nice. And trust me, we noticed that Belize map behind you you're representing, right?
Always.
All right, let's talk about this great work that you guys have been doing. And quite a way to start it off when you say that you're updating something that's 2 decades old. Arlene, fill us in on what this is about.
Yes, so CZMAIA partnered with Dr. Emil Charrington and Dr. Professor Griffin from the University of Alabama in Huntsville to update Belize's marine habitat map that was developed under a coastal zone management project back in 1997. And so, yes, it is very outdated, and Belize as a country, while we're moving on a path towards, a blue economy, and so we felt that it is very important and timely to update our national marine habitat, focusing on key coastal and marine ecosystems that contribute so much to Belize, our livelihoods and our economy. There's this saying that we can't manage what we don't know if we don't know where it is, the extent, and so this is why this initiative is very important for not only coastal zone, but Belize in general.
And Delwin, perhaps you could tell us what all is sort of involved in getting this sort of information, and how we actually get it, how we use the technology to accurately show the information that the map needs to show.
Well, the technology that we use is a lot of GIS. In combination with remote sensing as well. And that is the whole purpose that I came here to learn about how these experts and research scientists work. And just seeing them work here is kind of like blows my mind on how vast we can use this type of technology. So our role, or my role, I guess, is gathering some of the data that already exist in Belize to validate some of these models or algorithms that would be used to produce this new habitat map. One of the recent work that we did, and that is a huge part of this, is collecting ground truth data that kind of validates what is actually on the ground and kind of refer it back to their models and their output. So I think that is one way that we are using it, our GIS and remote sensing wisely.
Now, let's talk about what this map has traditionally been used for and why the updated information can help you. As you said, Arlene, you have to know what you're working with.
Yes, so I can start and maybe Emil can chime in. Yes, so in 1997, when after the map was produced, it was very an important I guess, a tool to inform some management decisions, such as the declaration of marine reserves and other protected areas, looking at ecosystems coverage. It informed the development of, the National Protected Area Systems policy and plan. And so at that time, it led into key policy and management documents that served a foundation for our protected area system that we now have in place.
Yes. Dr. Charrington?
Yeah, thank you. Just to add on what Arlene said, so before Coastal Zone Management Authority and Institute back in 1997 developed this work, it was really hard to get an idea for the different management plans that exist for our marine protected areas. It was hard to really know how much seagrass do we have in a specific protected area? And seagrass is, being important ecosystems for manatees, for example, or how much, coral reef do we have? We talk about the Belize Barrier Reef System being the second largest barrier reef system in the world. And it's part of the larger Mesoamerican reef. But with data like this, we're actually able to say, okay, we have, X many thousands of hectares of coral reef. And one of the interesting thing to point out with this and this project in particular that's funded partly through the Group on Earth Observations Biodiversity Observation Network, GeoBon, and Microsoft, is that this is one of, I believe, and Arlene can correct me, I think it's one of only 5 or 6 projects of this nature being funded at the whole level of the entire world. And so there are other countries in our region that say don't have this type of information available for their coastal and marine ecosystems. And so it just, again, allows Belize to continue to be a leader in terms of what it's doing in coastal zone management and again, properly stewarding our resources and our patrimony. So I think, from a scientific perspective, from a management perspective, from an economic perspective, this is really important work. Thank you.
Now, you're talking about using satellite technology as well to be able to capture this data. Just totally naive question here. Can we do that with Google Maps already? What's the difference with this?
So if I could just jump in on that one and something that Delwyn tapped on as well. So since 2005 when Google Earth came out, people are familiar with being able to see satellite imagery. Yeah. But the map that's like right behind Delwyn on, at least it's on my left, we're looking.
Are you guys in the same room?
We're in different floors of the same building.
Okay.
But the map that he's showing is what's called a classified image. And so you take that image and you're using these machine learning complicated algorithms and you're saying, this is seagrass, this is coral, this is bare substrate, this is algae, etc. No, and this is actually really complicated work. And so what Delwyn is showing you is actually the product of 524 individual satellite scenes that have been captured over Belize from 2017 to 2021 from a mission called Sentinel-2, which is launched by the Europeans. And so it's actually really complicated work. And again, Coastal Zone, one of various applicants to this to funds from GeoBon and from Microsoft, and they said, hey, the proposal that you put in looks really scientifically sound. The results that you're going to have are really promising, and so we want to fund this important work coming out of Belize. And again, Belize was competing probably against multiple other nations, including other neighbors in Central America. And so again, yes, we might have satellite imagery, but the process of extracting meaningful information out of that to say we have this much seagrass now compared to how much we had in 1997, like we haven't done that before.
Yeah. Even I noted the water turbidity, the coral, and seagrass, as you've mentioned quite a few times. That's the level of complexity and comparison that you'll be able to make.
Yeah, and then just to also quickly mention that along with Coastal Zone, we have a sister project that's funded through NASA And we call it the BZSDG project, where we're again also using satellite imagery to look at how water quality changes. And so the ecosystems like grasses and coral reef, et cetera, for the most part, don't change very frequently over time. But things like water quality change quite frequently, and Coastal Zone has a pretty strong monitoring program where they're sending people out into the field to collect that kind of data, and then it's being complemented with satellite imagery that gives scale estimates of how that works, but it can't be done if we don't have the data from the field.
Yeah.
And Arlene, perhaps you could also tell us a little bit about who like assisted and helped the CZMIA come up with this, or to help with this initiative, because it was a sort of a collaborative effort, right?
Yes, definitely. This is a collaborative effort, not only within the organization itself, but with many other partners, other government agencies, as well as non-government agencies. And this is really where we have leveraged, data that is already available, the good work that is being done by agencies on the ground, like those in the National Coral Reef Monitoring Network that provided their data on coral reefs, which really made it easier and less time consuming, and only needing to collect data in areas where there were some data gaps for that particular habitat. And so definitely we want to thank all those agencies that assisted us with providing historical and recent data to inform the updating of this map, which really will be openly available, accessible to the general public, to the universities, to everyone who needs access to the map.
Yeah. I think some of the data that'll be really interesting to see will be mangrove coverage, and especially how that's changed in 20 years. What are some of the other factors that you're looking forward to see?
Yes, so in terms of mangrove coverage, that is a very important ecosystem for Belize. And it's not to say that we haven't done anything in the 20 years in terms of habitat mapping and looking at coverage. And actually, through recent projects and initiatives, we were able, with support again from and collaboration with Emil, to update our mangrove coverage. We were looking specifically at those within the Belize Barrier Reef Reserve System, as we were working towards getting Belize off the danger list, which helped us to inform that decision, as well as under the Marine Conservation and Climate Adaptation project, where updated mangrove coverage assessment were done, I think, in 2019. So we've done a lot of mangroves, but we're really looking forward to that information on seagrass, which is really one of the key ecosystem that we know less about in terms of status and coverage, and really to inform some policy recommendations and management decisions. We know from the available science is that in terms of the importance of these ecosystems to blue carbon and the potential to assist in climate change mitigation is very high. So we are looking to assist getting this map updated so we can help to identify priority areas for seagrass protection, and to also look at the potential for blue carbon in Belize.
Mm-hmm. And other data, Delwyn, I'm sorry. Let's get you back into the conversation here. As you're there working along with Dr. Charrington and the team, what are some of the observations for you that stand out?
Hey, sorry, my mic was muted. But one of the interesting things that I see is the outputs. Like just hearing about it is one thing, but actually seeing it in front of you is another, and seeing how complex these analyses can get, all the little errors you can get, all of that is a very learning experience for me. And I can't wait to see how the ground truths information that we collected and other organizations collected actually will feed into this, because that's one aspect that I really enjoyed about the project, is that it's all about collaboration at the end of the day. Like, no man is an island, and working with data sets at a national scale, you need that collaboration, because many organizations work in specific areas, and it's our responsibility to help fill some of those gaps and make it more comprehensive, so we have something at a national scale that we can show and compare to those maps that we had in the past.
And that's the map that Dr. Charrington was talking about behind you there.
Yes,
Tell us a bit about what we're seeing.
So as you can see, it's not that colored as well, but here this, it doesn't show that well, but up here, let me see if I move my fingers correctly. I think this is Belize City. This is Belize City right here, and as you can see already, you can already start to see, I believe, some of the coral internef here in this little white patch here. And here is like a channel, like a deep channel where a lot of the big cruise ships probably pass.
That's the English key channel there?
Yes, that's the English key channel right there. So you can already start to see some of these preliminary results here.
Oh, wow. And what's the difference with the pink and the lighter blue? The green is the seagrass, right? To the top of the screen?
No, I'm not too sure, but it could be that it's just really shallow water.
Okay.
But it could be seagrass, and that is why, again, ground truthing information is very important, so that you can fix these types of errors or things that the models don't pick up. Because again, with these control models, we actually get to say this is this, and maybe this is not this, and we edit it and things like that. So.
And Dr. Charrington, you can perhaps also talk about what sort of the upgrade or what it's like then to work with this sort of upgraded technology and implement it in Belize as well.
Yeah, thank you, Gavin. So just to say, so I actually used to work at Corazon back in the year 2005. And since, been a few other places, but just to say, when I was at Corazon in 2005, this type of processing was done on desktop computers with available images. The first map was actually generated only with a few images, and by comparison, what Delwyn just showed you, and what's on the screen behind him, was again generated using hundreds of images captured basically every 5 days by this Sentinel-2 satellite. The Sentinel-2 satellite, the spatial resolution, or basically the size of the pixel, the level of detail it has, is also it's much higher than the data that we usually use, which was from the Landsat satellites from NASA and the U.S. Geological Survey. And so one thing is the level of detail. The other thing is how we're processing it. So we're using these cloud-based resources that Microsoft is providing through their Azure platform. And so again, that's part of the project is Microsoft providing these additional tools where we can implement these different algorithms. And so it's a different ball games than compared to 20-something years ago when my predecessors at Corazon did this all on desktop computers. And then also to say, just to add to something that what Delwyn and Arlene said, and work that my supervisor, Professor Griffin, is really spearheading as well, is later today we have a capacity building exercise, a training session with people from 15 different institutions across Belize. And so kind of building off of what Delwyn says, that this work really has to be done kind of teamwork with multiple institutions. And so the idea being that it's not just something that Corazon and GRH or the University of Alabama in Huntsville are doing, but it's a team effort involving multiple institutions, their data, their know-how for different places, et cetera. And of course, leveraging, again, these great resources that Microsoft and the Group on Earth Observations, Jaban, is providing.
All right. Well, this was definitely, this is definitely a great initiative, and it's been great to learn a little bit more about it. But we are very quickly just running out of time. But Arlene, I'm just wondering if quickly before we close, if there's any final message you'd like to give, or for all our viewers who may be interested to learn a little bit more about this great project.
Thanks, Devin. Yes, more information on the project is available on our website, www.coastalzonebelize.org, and we would be happy to share any other information via email. But we just wanted to, as part of the outreach and communications for this project, to let the general public know or get an update as to where we are. The project was launched last year, and we are nearing towards the end of the first year. So we just wanted to give an update, noting it's a very timely initiative. We now have a new and innovative ministry with responsibility for blue economy. And so we feel that this is an important initiative that ties into the work of the government and as well our other partners to really put Belize or keep us there on that center stage as innovators and using science to inform decision making.
And reminding us beachgoers that we may not like seagrass, but it has an importance as well.
Yes, definitely.
No, we appreciate it. Definitely innovative work taking place. You're looking at preserving or natural environment, but also using high-level technology to be able to ensure that we can have proper monitoring. Great job, guys, and best of luck, especially with your capacity building today as well.
Thank you all.
All right. And with that, we're going to go ahead and take a break. And when we come back, we'll be talking to a group out of Corazon. They're called Caring for Corazon. And they'll tell us about one of their latest initiatives that they are providing in the community. So please stay tuned.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
It's time to put your TVs on lockdown. COVID won't stop us this time. After a year of waiting, Summerfest is back, pandemic style. If you're under the age of 18 and you think you have the talent, we are looking for you. Submit videos to us on Facebook, Instagram, and email. Or join us here at Channel 5 on Coney Drive to audition from July 26th to 30th from 10 a.m. to midday. Be a part of Summerfest 2021 and show Belize your talent.
Es un hecho. Únicamente con Smart obtienes todo realmente ilimitado. Solo con Smart obtienes datos ilimitados en cualquier momento. Mientras que con el otro proveedor solo son datos dobles los fines de semana. Con datos ilimitados todos los días no hay necesidad de esperar, así que es un hecho que nuestros planes ilimitados superan a la competencia. Por lo tanto, no permita que le digan cómo y cuándo usar sus datos. Y obtenga llamadas, mensajes de texto y datos ilimitados. Vive la verdadera experiencia de planes ilimitados con Smart. Es un hecho. Haga el cambio y viva Smart.
Been drinking all night, feeling so high. Better not drive, won't even try.
Been drinking all night, feeling so high. Better not drive, ain't gonna try. Been drinking all night, feeling so high. Better not drive, ain't gonna try. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. People die every day, I'm not going with ya. I'ma find my own way, I'm not going with ya. It's okay, I'll wait. Even good people make mistakes. I don't wanna realize when it's too late. Drinking and driving is never safe. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. Been drinking all night, feeling so high. Better not drive, ain't gonna try. Been drinking all night, feeling so high. Better not drive, ain't gonna try.
Into our final conversation for today, where we get to find out more about the organization called Caring for Corazon. And we're joined by two of the co-founders, Juan Chan and Patty Santos. Good morning.
Good morning.
Morning.
How's the weather in Corazon this morning? Okay, so definitely looking forward to hearing about this initiative that you guys have undertaken. But before we get into that, let me just hear about how you came together to start this organization.
It was about 8 months ago. Juan and I were discussing the fact that we noticed there were some drivers, of course, all who break the speed limit and in the process run over and kill dogs in the road. And we had a personal experience in which we found a dog that had just been hit and killed, and we pulled her to the side of the road and covered her and called the police team to pick her body up.
Mm-hmm.
This was upsetting to us, very unsettling. And so then we started to say, what can we do to raise the consciousness of others and make them aware that this is a hazard? Mm-hmm. And that's sort of how the whole project began. We decided that maybe we could erect some signs that look not unlike pedestrian crossing signs, only they had pictures of animals on them that said things like, please slow down, let me cross, don't run over me, that kind of thing. And we sought permission from the mayor each time we located a spot where we felt it would be effective.
Oh.
And the mayor would do this, and he was always very willing to allow us to do this. So that's how it all kind of came together for us.
Yeah. What was the community's reaction? I mean, this is so unique to see a crossing sign for reminding us that the dogs may be passing through, and especially in Corazon, where even passing through the villages, it's a main thoroughfare. What's the reaction been?
I will tell you this. We, in the process of erecting one of the signs, an American lady was visiting Corazon, and she got out and took a picture of Juan and the other gentleman who were assisting him in erecting the sign. And she said, I've never seen anything like this, not in the States, not anywhere. And the people in Corazon have been extremely happy to see them.
And that was, that's how the initiative started. But since the signs, you've also branched out into doing some other projects as well through Caring for Corazon. Can you tell us a little bit about those, Juan?
Well, again, we saw many hungry dogs around town. Some of them were seeking for fresh food and water. So we began to purchase, PVC pipes and elbow joints to form up these feeding stations. And as well, we contact our beloved friend, Diane Bautista, who is a local artist from Corazon, who painted and, gave us the first feeding station for our broadcasting,
So how many of them have you set up so far? And you've done it in different parts of Corazon as well, right?
Yes. Yes, we have erected the first one in Corazon town, which is at Mama Lowe's, in front of the Central Park. We have erected one in Consejo Village, and we have erected one at the Philip Bates and Son storage unit. As for now, we have 3.
We also have one at a local car wash station called the Clean Getaway. And we had customers right away in many of these locations, as you can see.
Clearly.
And it was kind of cute because they were waiting in line for us to get their food and water replenished so they could take advantage of it. So that really warmed our hearts.
This is such a cool initiative. What has been the response of the businesses or the homes where you have put these feeders? Because naturally it means that the dogs or the cats will gravitate to that area. Have they been open to that idea?
Absolutely. Juan and I don't ever presume to erect a feeding station without first seeking permission from either private owners of homes. As you see in this picture, this is the private property of a gentleman who was very willing to let us do it. And the businesses that we have used for feeding stations have also been very amenable to having us do it. So, yes, they've been our saviors. They're the ones who have helped us to do this.
Who's providing the food for the feeders?
Well, in the beginning, Juan and I were providing everything because it was a project that we talked about and wanted to do, and a little organization which is charitable, not nonprofit or for-profit. It's just a charitable organization. So we were providing the stations and the food. And very interestingly, as people began to realize that it was we who were doing this, they came forward and said, how can we help? Can we offer donations? Can we offer food? And I think that surprised us both. And so we said, by all means, we're happy to take whatever donations you have, and we will be wise stewards over that money, and we have been.
And I imagine that, it's the upkeep has also attracted what you call your customers, so that it has been a successful project so far.
Yes, we love the idea that we are putting together in our town, and we will also see, if this can be done in other districts of Belize, which is very appealing to many people. And we also have our Facebook page, and many people commented to us, on the Facebook page that they would want this brilliant idea to be done in San Pedro Island, in Orange Walk, Belize City, and we are trying to do that for our community.
So does it sound like caring for Corazon might be growing a little bit?
Surprisingly, a lot more quickly than we ever thought. But that's a good thing. That's a good problem to have. So when people call us and ask us, can we have one or could we help? We're so excited to do that. So, but it's keeping us busy. We committed that if we were going to put those stations up, we would need to check on them a minimum of twice a day.
Yeah.
Because it's rainy season now, so we go by and make sure that the food is always dry and it's always fresh and everything is replenished. And so we will put them up as we know that we have the capability of taking care of them. For example, the one in Consejo Village is being managed by a generous donor to us, and she knows that that's kind of a long way for us to go twice a day.
Yeah.
So she's maintaining that one.
Let me ask, as someone who loves dogs, I think that it's easy for me to understand why you'd be inclined to do this, but not everyone is as open-minded. How surprised are you by the reaction and the openness of the community in recognizing this particular need?
Well, I will say that both Juan and I have received more positive than negative, but there are a few haters out there, and they think that we're promoting disease or we're making a bad situation worse. But our response to that is part of the ongoing efforts of caring for Corazon will be to teach pet owners in the community how to be responsible for their animals, because yes, in a way this is a Band-Aid, and yes, there are people who really resent the fact that we're doing this because they think we're worsening an already poor situation. But we can't go home at night seeing what we see on the road every day and close the door and say, gee, that's too bad about those animals.
Yeah.
We need to do something about it. And we will continue to try to teach people about the need to, I mean, if just male dogs were neutered, they wouldn't be running around crossing with female dogs and then creating another litter of unwanted puppies or kitties. So teaching is a very important part of what we plan to do.
Yeah, absolutely. Well, we saw the feeders and the work that you guys were doing, and we really wanted to know more about the people behind it. And I appreciate what you said, that we could help people understand that this is a start, one, that these animals are humanely treated, and then move to the next phase where you can educate more about proper pet care.
Yeah.
Well, thank you guys for joining us this morning.
Thank you so much for the invitation. We were not expecting it, and we certainly appreciate the fact that you called us yesterday. So we're grateful to you as well.
All right. Well, you guys take care and keep up the good work.
Yeah.
All right. And with that, we're going to go ahead and take our final break. And when we come back, we'll have our wrap up. So stay tuned.
"2020 taught us the importance of being connected to the virtual world, and NextGen is here to keep its commitment to you. Even if you're physically apart, NextGen keeps you digitally connected."
Okay everyone, thank you for following me today.
NextGen provides more than just an internet plan. They provide service plans that support all your online needs. Sign up today and get your NextGen's ultra high-speed internet service. NextGen, powered by Central TV and Internet.
Why, Tony? Boy, Keith, what you going on, man?
But actually, because see, we can need to buy a stack of them plastic plates and cups for my grocery shop because I run low.
Boy, I stopped importing that thing since April 15th, you know. And I just ran out to the last batch, must have been like 3 weeks back, you know.
Man, do I usually have anything? What you going?
Check this, right? Under the new law, we ban all single-use plastics, so that the cups, plates, forks, spoons, and knives, all of that. Since April 15th, can't import none of them. Starting January 15, 2021, you can't manufacture them. April 15, 2021, you can't sell them. And after July 14, 2021, if you get catch with any other thing, you will get fined.
Me never know this. I guess I have to make some changes then. I have to make the customers know that anything not available. Anyways, bro. Thanks, man.
No problem, man. Take care.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
We're back. Great conversations today.
Yeah, and we're just getting our show wrapped up. We want to say thank you to all of our guests. Of course, our first guest was Dr. Laura Friesen, and she was giving us a bit of perspective on the COVID-19 virus, given the situation that we're in right now with a lot of rising cases, as well as the very concerning situation where we've seen 4 deaths over the past 2 days.
Yeah.
And of course, it's never a time or it's never too, we can never give you enough reminders then, I guess, about how we can't let our guard down based on what we've been seeing, internationally. And I think that especially in the context of variants, when we think about, how that trend is going and what may or may not be here
She
in
broke
Belize.
down the transmissibility for us this morning. Because
100% more.
Pretty much, yeah.
And
what we were facing last year to now.
Yeah, and I think that, and we were talking about this a little bit before in the break, but I really appreciate how Dr. Friesen put this conversation in context in terms of, what are the risks?
Yeah.
And based on whatever choice you make, what risk you will have if you do get vaccinated, if you don't get vaccinated, and what can happen to you either way. I think it's a great way of thinking about it. Yeah. So, when you think about the choice to get vaccinated or not, if you haven't been already, think about what can happen to you, if you do end up getting COVID, or what are the chances of you getting COVID now, knowing how transmissible the variants are. If you do get one of these, variants, what's going to happen to you, and if you weigh the balances up, I think that, and Dr. Friesen said it, that, it still favors much more on getting the vaccine, that the risk to your life and, those around you, it lessens significantly.
Well, and I just appreciate, I really do appreciate her joining us this morning. And of course, to our viewers, we did try to get to as many questions as we could. But of course, we'll try to ensure that we can keep on bringing you information to help you make the right decisions of how to maneuver yourself safely through this pandemic. Things have changed. Delta is more transmissible. Vaccines are available. And so we want to keep you as updated as possible and get you the right information. So we appreciate Dr. Friesen from taking her Facebook. She really posts a lot online and helping people to understand stuff, taking it from Facebook to here on Open Your Eyes. And then we also want to thank the representatives of the Coastal Zone Management Authority Institute and also Professor Charrington, Dr. Charrington, for telling us about the ongoing work that they're doing with updating the natural marine habitat map. Really interesting stuff when you consider how they're using such advanced technology to be able to capture a better picture of what we have in our marine habitat.
Yeah, exactly, and especially knowing how important our marine resources are to Belize, it's really great that this project is underway and that we are using the advanced technology. And like Dr. Charrington said, it's interesting that, you know, Belize is a leader, or becoming a leader in this area, at least for the region. So I was pretty interested to learn about that topic, and we hope that you were too. And finally, of course, we had our conversation with the co-founders of Caring for Corazon, which is a group which aims to spread awareness as well as starts projects to assist animals in the community. And of course, they have done things like put feeders and as well as animal crossing signs, which I also really like because, it's already, when we think about animals in Belize, some people, even the pets that they have, caring for them can be a challenge, or getting the right messages out there about caring for their own pets. So, when people are showing even the extra, going the extra mile and showing compassion for stray animals, it's really heartening to see and really encouraging. So we want to thank them for coming in and discussing all about Caring for Corazon.
Just, and it's exactly what it is. It's just a kind and caring thing to do. These are living beings after all. And, we all recognize that there is a challenge with stray animals, but that doesn't mean they should be starving to death on the street. So kudos to them and to the wider Corazon community for showing their support as well. But that is all the time we have for today. If you would like to contact us, send us an email at oye@now5belize.com.
You can find us on Facebook at Open Your Eyes BZ and on Instagram at OIE Belize.
And remember to tune in tomorrow morning at 6:30 when you open your eyes.
Start your morning right.
Until then, keep your eyes, your mind,
and your heart open.
We'll see you soon. Enjoy your day.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.